If you ever move to another state during retirement, or even if you just move across town to another zip code, that could change things with your Medicare. And if you don't do it in a certain way, you could end up losing your Medicare plan because you have moved out of your service area, because service areas are based on zip codes, which means you could be stuck paying 100% of the portion that Medicare doesn't cover out of pocket without realizing it. So let's make sure that that never happens to you. Today, we're going to cover 3 Medicare mistakes to watch out for when you're moving to another state, or sometimes even just moving to another zip code. I am going to also go over a quick checklist so that you can make sure that everything is in place before you move. The first pitfall is that you cannot bring your Medicare Advantage or prescription drug plan with you when you move out of the state. And in some cases, you can't bring them with you when you move out of just your zip code. And essentially, you lose your coverage when you do that. And if you don't do anything about it, you could find yourself without coverage until the next annual enrollment period, which runs from October 15th to December 7th. And when I say without coverage, I mean you would not have a Medicare Advantage plan or a prescription drug plan. Medicare supplement might be different. We'll talk about that too. But this could leave you on the hook for paying the 20% for any medical bill that Medicare doesn't cover. And for prescription drug costs, you could pay 100%, which could easily lead to $10,000 or even $100,000 in serious cases of medical bills and or costs for prescription drugs. Now, both Medicare Advantage plans and prescription drug plans are location-based. So regardless of which path that you have chosen, Medicare Advantage or Medicare supplements, this affects you. So what do you do? Well, the solution is simple. You need to inform your insurance company of your move before you move. If you do this, you'll be able to set things up so that you have coverage when you move, or find out if your plan will be able to continue with you. When you move, you get a special enrollment period that allows you to enroll in a new Medicare Advantage plan or in a new Medicare Part D plan in the new location without having to wait for annual enrollment period anymore. The special enrollment period starts 1 month before you move, and it ends 2 months after you move, so that gives you a full 3-month window to make the change. So if you're moving on, let's say July 12th, your special enrollment period starts on June 1st, and it ends on September 30th. Now, you can also inform your plan after you move, and you'll get a 2-month special enrollment period, which is the 2 months after you've moved. But I highly recommend sorting everything out before you move. And this is really important so that your plan will be ready and you'll have coverage right away. Now, there is also one little detail that so many people don't know about when it comes to moving. And this is the second thing that you need to know when moving. There's a loophole that while moving, you are allowed to switch from Medicare Advantage to Medicare supplements even if you normally wouldn't qualify. Most of the time, if you want to go from a Medicare Advantage plan to a Medicare supplement plan, you have to medically qualify for it. They're going to ask you health questions through this whole questionnaire to see if you're healthy enough. And if not, you'll be locked out. However, this is the loophole. If you're moving to a new location that is out of your Medicare Advantage plan's coverage area, then the medical questionnaires are thrown out the window. At that point, Medicare supplements have to take you and they have to let you enroll. This is known as guaranteed issue rights because you're guaranteed to be issued a Medicare supplement plan if you want to enroll in one. But these rights, they don't last forever. They fall within a window of your move. You can use this loophole starting 60 days before you move, up to 63 days after you move. Now, don't ask me who came up with the number of 63. That's just Medicare. After 63 days, then things go back to normal, and you'll have to medically qualify if you want to have a Medicare supplement plan once again. So if you're about to move and you're not sure if you should choose between a Medicare Advantage plan or a Medicare supplement plan, give us a call. My team will be happy to help you to compare the plans that are available in your new location, of course, at no cost to you, and will also help you with all the requirements that you might run into and anything else related to Medicare while moving. But okay, what if you're already on a Medicare supplement plan? Is there anything that you need to watch out for when you move? Well, yes, of course there is. This final pitfall is that when you have a plan that works across borders, such as a Medicare supplement plan, but you don't inform your insurance company of your move, you could end up in a bad situation. When you sign up for a Medicare supplement plan, you're able to use it anywhere in the country as long as the doctor that you're visiting takes original Medicare. However, you still have to inform the insurance company of your move because different states have different price points and different states have different rules when it comes to Medicare supplement plans. For example, The lowest cost Medicare supplement plan that I could find in Los Angeles at this time, no tobacco, no household discount, etc., is $162 a month. That's for someone who is 65 years old. But in Miami, where the rules for Medicare supplement plans are different, the lowest cost that I could find for a Plan G was $263 a month for someone who's 65. If you're moving from Miami to Los Angeles, that's great because the monthly cost for you is probably going to go down. But if you flip things around and you're going from a cheaper area like Los Angeles to a more expensive area like Miami, then your monthly premiums will go up. So you might be thinking, well, why don't I just pretend that I live in a cheaper state? Why would I inform the insurance company that I've moved if the premiums are going to be more expensive? Well, you can't do that because first of all, it's considered fraudulent. And if your insurance company finds out, they could drop you or back charge you for the higher rates that you didn't pay. But also remember that your supplement plan is going to find out that you moved through Medicare knowing what your address is. But if your Medicare supplement plan drops you and you no longer have coverage from them, remember, in many cases, you can't just go back to a Medicare supplement without qualifying, going through medical underwriting. So don't be sneaky and don't put yourself in a bad situation. Besides, if you really can't afford a Medicare supplement plan in Florida or wherever you're moving to, then you probably shouldn't have a Medicare supplement plan to begin with. Consider instead something like a $0 a month Medicare Advantage plan. Okay, here's the checklist to make sure that you do this right. Let's start with Medicare Advantage plans. If you have a Medicare Advantage plan, you need to inform your insurance company of your move 2 months before you move, and that will trigger the special enrollment period. The second thing you need to do is contact a licensed insurance agent in the area where you're moving to get free assistance in finding the plans that are available. Now, be very careful here. You want to make sure that the insurance agent you're working with looks at all of your options, all of the insurance companies, because if they don't, you're going to get biased information. Sometimes there are things called captive agents, agents who work for one insurance company. They only can tell you about that one insurance company. Don't put yourself in that situation. If you don't have a good agent to work with, then consider working with us here at PlanFit. I have trained my team to look at every option available in your area. And on top of that, they are not compensated by insurance companies. They are paid salaries here at PlanFit. So they will give you unbiased advice. The third step is to find the new plan and enroll in it before you move to your new location. You want to do the timing just right so that your new plan will start at the first of the month when you're moving, or if you're moving near the end of the month, you want it to start at the first of the month after you move so that you have continuous coverage. While you're enrolling in the plan, you will either need to complete paperwork for a new Medicare Advantage plan if that's what you're doing, and use your special enrollment period for moving, or if you're going with a Medicare supplement plan, then you need to use the guaranteed issue rights to join the Medicare supplement plan in your new area. The last step then is to update your address with Medicare. And the way to update your Medicare address is by contacting Social Security and telling them of your new address. Social Security manages all of that. And when you update your Social Security address, it automatically updates your Medicare address. You can contact Social Security at 1-800-772-1213, or the easier way is to go into your Social Security account on ssa.gov. And if neither of those work, then you have to visit the Social Security office, which of course is the last resort because that can take the most time to visit them and to change your address. But change your address with Social Security, and that will automatically change it with Medicare. Okay, if you have a Medicare Part D prescription drug plan, all of the same steps for Medicare Advantage apply to that. So you follow the same steps. Now with a Medicare supplement plan, things are a little different, although kind of the same. You need to start by notifying your insurance company that you're moving outside of your service area and give them your updated address. That will trigger a rate adjustment and your premium will change. It will cost you either more or less, depends on where you're moving and where you're moving from. When you receive that information, you need to consider a very important thing. Make this consideration in conjunction with an insurance agent. So contact a licensed insurance agent and get their assistance, because Medicare insurance companies have different rates in different places. Sometimes, let's say company A is the leader in Los Angeles. In Los Angeles, they have the lowest price. But that same company, company A, might be the high-priced insurance company in Miami. So you need to take the time to figure out, do I want to stay with that insurance company? Don't just stay because you've always been with them. So an insurance agent can look at all the available plans, can quote all of the available insurance companies, and figure out which insurance company is offering the best rate and should you consider joining it. And the last step with Medicare supplement plans is the same. Contact Social Security and notify them of the change of address so that then it will be updated with Medicare. Now, keep in mind, this only applies to people who are moving. If you're moving outside of your service area, which could be your state or it could just be your zip code, then this applies to you. And if you're one of the people who likes to travel overseas, then there's a whole different set of rules that you need to know about. Rules that I talk about in the next video that you should watch right now after this one.